wonderful to see everyone, and it's always great to see the Acumen community coming together across the globe to focus on the moral imagination in this time of crisis. Couldn't be happier to have Gayathri Vasudevan, founder of LaborNet, and Sara Saeed, the founder of Sehat, Kahani, two social enterprises, one in India, the other in Pakistan, respectively, talking about the world that they see it in their countries, how they are changing their companies to respond to it as they are looking at being ready for the world that is emerging. And thank you all for coming. Sara, I'm going to start with you. Yeah. You're an Acumen Fellow from Pakistan, a doctor who saw both a great need as well as real opportunity in your country when you started your company. If you could say a little bit about what your company is first, and then what's going on in Pakistan and how you are responding.
Thank you. It's an honor to be here. And I particularly like this concept of bringing India and Pakistan together and displaying stories from both sides. So thank you for doing that. And hello to everyone. My name is Dr. Sara Saeed. I'm a medical doctor by profession and a public health specialist. And I run a company back in Pakistan, which is called Sehat Kahani. Sehat means health in Urdu and Kahani means story. So we're trying to change the way health stories are written in Pakistan. What we do is we try to solve two problems with the solution of technology. So first, the problem that is very close to my heart, it's called the doctor bride issue in Pakistan. That majority of our medical doctors are female, almost 70%, but only a small amount practices. So what we do is we enable these female doctors to practice from their homes. And the other problem that we solve is the opportunity for people to go to a qualified doctor in Pakistan is extremely low. Over 75% people don't access to a qualified doctor in the country. They might go to a quack or a nurse or a midwife, but they won't be going to a qualified doctor. So what we do is we connect female doctors from their homes to patients who need healthcare using the technology of telemedicine and more specifically video consultation. And in the last 3 years, we worked through two service lines. The first is focused on a low-income community. So in low-income communities where people don't have access to smartphones or technology themselves, we partner with nurses who have their own clinics in these communities. We upgrade these nurses and we train these nurses for a software so that whenever a patient comes to them, they can then connect the patient to an online doctor present in a laptop and a software that we provide them. These nurses also record their history into an EMR system, and the prescription is also printed and given at the clinics. The other line of work that we have is focused more on the masses. So Pakistan being a 220 million population, almost 75 million people do have access to smartphones now. And the problem of healthcare exists not just in the low income, but also as you go in the upper tiers. So in this segment, we have a mobile application for anyone who has a smartphone and internet connectivity to consult a doctor online 24/7 using either chat, audio, or video consultation. Sehat Kahani has been active for the last 3 years. And for the clinical segment, we have 26 clinics across Pakistan, and we've served over 130,000 people till date. And for the app, we serve both retail users, and we also give this app to corporates to ensure their employees for outpatient consultation. So we work with around 23 corporates, and we also work with almost 22,000 people on the app. The situation in Pakistan right now, as all countries have been hit by the COVID-19 pandemic, Pakistan has also been hit. And we are around 3-4 weeks in when the first case was detected in the end of February. And we have around 4,000 cases up till date today, and we've had around 58 deaths, unfortunately. But the issue in Pakistan is more that we are under testing. We're not focusing a lot on testing, so we actually don't know how many people have been affected. But what the government did was, around 2 weeks from today, they ensured a lockdown in the country. And when a lockdown happened, that means that people couldn't access any doctors, any OPDs, any hospitals until and unless they're going for suspicion of COVID-19. So a lot of people in the country were stranded medically because a lot of people had suspicion of coronavirus, but a lot of people also had other medical issues for which they regularly needed to go to the doctor. So their pregnancies, their chronic diseases, their children who need doctors. So while our clinics had to be closed down because of the lockdown situation, me and my team revamped our application. And what we did was that the application that was paid, so in our mobile application, the patient had to pay after the first consultation. We decided as a company that we are going to make both our retail and corporate app absolutely free for the next 3 months for people to access doctors whenever they want, wherever they want, 24/7. So when a patient downloads our app now and wants to use it, they can see a list of doctors available for online consultation, almost 200 of them in various times of the day, from which they can get an online consultation for themselves, their families, as many times as they want. So we're not charging them anything. And this we replicated with our corporate clients as well. And what it led was that if we used to get 50 to 70 consultations a day, now we're seeing almost 500 to 700 patients a day. And we've just seen over 8,000 patients in the last 10 days, 10, 15 days when we've made the app free. This also brought us to work uniquely with the government of Pakistan, more specifically Digital Pakistan. And now we're also working with the government to ensure trainings for nurses, doctors, making sure that we get more doctors onto the Sehat Kahani platform so that we can serve more people. So that's something that we're doing back in the country.
Sara, I mean, it's amazing. One, that you on the pretty much two days in, one, that private health clinics would be deemed inessential.
Yes.
And this keeps coming up, who decides what is an essential service? Rather than saying, let's have social distancing, but you can go to the clinic. And two, that your response was, even though I'm a struggling entrepreneur, I'm going to make everything free. And you called for volunteers. You called
Yes.
for doctors across the country.
Yes.
And what you're seeing is doctors from across the world coming to you. How are you responding to that?
So when we made the app free, I think as a company, we faced two challenges. One is, can we on a financial level bear the expenses of these doctors for the next 3 months? Because how we made money on the app previously was we used to pay 50% to the doctor of whatever the patient paid for the consultation. Now, if we were making the app free, the only way that we could pay the doctor is through our own pockets. So while we could have a limited number of doctors that we were paying per consultation on a stipend basis, we couldn't afford a lot of doctors on the app. So we reached out collectively to all our networks to make a call for volunteer doctors. And what we saw was that not only we got doctors from Pakistan, but many doctors from outside Pakistan who wanted to help, because the Pakistani diaspora outside Pakistan, especially the medical fraternity, they feel very strongly about any issue that comes in Pakistan. And they're always searching for places that they can go to. And normally the question is, where do we go? How do we serve? Where is the platform that we can all come on? And because the onboarding for medical doctors on the app is a very simple process, it takes around an hour or two to get their degrees, get their certifications and onboard them. Around 50 to 70 doctors on our app are actually based outside Pakistan, in Qatar, in Dubai, in Australia, and they're all working on volunteer basis with us. And these are not just GPs, they are specialists. These are mental wellness specialists who normally charge a lot for doing consultation in their countries. But they're doing it because although they can't be there in physicality, they just want to be helpful in one way or the other. One very interesting thing that we saw was a lot of doctors that we had in the community, they developed a very good relationship with each other in over a week. So we have WhatsApp groups over WhatsApp groups where doctors are helping each other in order to provide the best care for the patient. So we're also developing a very caring doctor community within our female doctors who are helping each other grow in this crisis and learn from each other very rapidly, because also developing capacity is so important in this period.
So you've got this enterprise now that is women doctors from around the world helping some of the poorest women in your country on a technology platform, something that you tried to do for many years and had a hard time getting people to think that seeing a doctor using technology wasn't the same as seeing a doctor, and suddenly it's just shooting to another level. And also this idea that government is now partnering with you. What are you seeing for the future of a more resilient, anti-fragile healthcare system, Sara? In a country like Pakistan, where the last time I looked, the health budget was about $150 million, so less than $1 per person per year. And overcrowding and rural areas difficult to get. What are you learning in rapid time that we need to take into the future?
So I think it's unfortunate, from my end, it's unfortunate that it took a crisis for government and the private hospital sector in Pakistan to realize the importance of telemedicine. The good thing is they have realized now. So the government is looking for off-the-shelf initiatives such as ours to integrate in their systems and provide it. Hospitals are looking for solutions through which they can provide telemedicine to their patients. My only challenge and my only concern is once, inshallah, the pandemic is over, because we don't have policies for telemedicine in place, because there hasn't been any work at a policy level to introduce telemedicine, even when it's being done by the government in all major hospitals in Pakistan, we're going to go scrambling back to the pre-COVID era where we're not going to realize how digital technology can help us. Even before COVID-19, we have 1 doctor for 1,000 people in the country. We have 0.7 nurses for 1,000 people in the country. We have very bad maternal and infant mortality rates. 75% people in Pakistan don't see a doctor. So we're not doing, we have a very, very fragile healthcare system and a very, very fragile primary healthcare system. So if we can at this time realize that how telemedicine can build our capacity to see more patients and do less crowding in tertiary care hospital, I'm just going full force in making the government realize that there has to be a policy in place that can help put telemedicine at a government level on the map as a solution provider for times to come, because this is just one pandemic. It's going to keep, we are going to see more like these in the future, and we need to prepare now rather than stumbling every time we come across a pandemic.
Well, this is what's so exciting to me, though, about seeing the change you're making, and the fact that we do have a community now that can have different kinds of conversations with government so that we can make this change into the future, because it is such a glimmer of what this could be. So thank you. I'm going to turn to Gayathri and then open the conversation. So going from Karachi, Pakistan to Bangalore, India, I first met Gayathri Vasudevan on a construction site. She was characteristically wearing a sari, and was struck even then by the moral imagination of this woman who spent her whole life trying to really bring the informal workers into a safer, more prosperous way of contributing to their country by informal worker, construction workers, leather tanners, beauty salon people. By now, we've been supporting her for a number of years, invested. Gayathri has trained nearly 1 million people and has really changed many, many lives, as well as helped to create 7,000 businesses with at least 70,000 employees. When this happened, when Prime Minister Modi declared curfew, she was in process of training 100,000 very low-income workers around and across India. And so where do you go from there? Gayathri.
Thank you, Jacqueline. As always, it's an honor to be in your company, let's say, and learn from it, as well as the Acumen community has been one of a community which we can fall back on. Let me just, before I talk about LabourNet, let me just tell you the situation on the ground and then come to what we do. Everybody knows we have 1.3 billion people. Now 1.3 billion population, and let's just take the working population in the sectors that I deal with, right? Construction, we're talking 30 million people. And this is conservative. I'm being very, very conservative on the 30 million because agricultural labor often goes into the construction sector. So if I add the ones which are not counted, this number will probably double to about 100 million. Those who are in the absolutely transient between construction and agriculture. Then you have the textile, people who are stitching, who are closer to home, who are not tailors per se, but everybody in the ecosystem is 40 million. The auto segment, you're talking of 20 million. So if I just take 3 segments, one is talking of about 200 million people, affected. And I'm talking working age population. So I'm not even talking of their family members, what happens to all of them. I'm just talking of this individual who is working and therefore earning. Now, what had happened was, India is in a sense, I feel a catch-22 situation. We saw what was happening elsewhere, and we have a very charismatic leader. So we went in for lockdown without really understanding the implications of a lockdown for the poor. As Jacqueline was saying, the construction workers were stuck. They're on site. They don't have anywhere to go. There wasn't enough time to prepare and say, do I go, do I not go? So they were stuck. These workers get paid on a Saturday. They hadn't got enough essential food supplies for the week. If it had happened on a Monday, would we have been better off if the lockdown, I sometimes think to myself, 4 days would have meant food for 4 or 5 days. It is very small issues which we often don't realize because we don't buy grocery for a week. If it goes out, you can go to the store, you can buy, but it's not like you don't have the money to buy. There are two different issues. You see, shops can be open, but you don't have the money to buy. That, I think, was the situation that India ended up with. The second problem was, assume that you lived in the same place, like say the beauty segment or the auto segment. There are two problems. The finance minister did announce a package, but the ration card, the PDS system, what we call the public distribution system, had not been updated for 5 years. Your name is not there. So you're not able to afford it, even though you don't get your income for the day. So those who are not in poverty are plunging into poverty. And that's, a very scary situation, because we don't see lockdown being taken off completely, which means one more week and we're really, really in trouble. We don't know what to do. So let me just come back to what we do and then put it in context of these sectors that I spoke to. When we started LabourNet 13 years back, our thought process was fairly simple. Our tagline is enabling livelihoods. So we said there are only 2 ways one can, have a livelihood, right? You have to make money. Livelihood is, at the end of the day, money, which means either you save or you make more. There are just very simple definitions of livelihood. Now, if we take this as as our definition, how do each one of us do it? We do it because we have a certificate. Right? Somebody tells us, listen, you're a graduate. You have like Sara, you're a medical doctor. You did economics, you did something, you have a degree to say, you have a 10th standard certificate, you have a school leaving certificate. Something tells you that you are qualified, you can be counted. Now, in a country in which, if you say 90% of the people are in the informal sector, they don't have this, which means they're not counted. Very simple. If 90% of your population is not counted, you're not able to have a career path. If you don't have a career path, every decade that you lose, you're actually, instead of your livelihood increasing, you're actually going to go down. That means if you look at a person between 18 to 20 who should be in some form of class, vocational education, graduation, some class, is outside and is earning. So we started looking at on-site training and said that the way we need to do it is go to the sites. They're not going to come to your classroom. Go to the sites, train there. Don't be shy about, I want these tools. There are tools out there. There are ways to train there. Take the classroom where they are. That was our principle. And we said that's the way to go forward. The second is, we said all companies have value chains. So shared value is the way to go. So let's exploit shared value and create livelihoods around shared value. That was the principle by which we grew. Suddenly at the lockdown, we found that we had 2,000 employees, each one dealing with crisis situation. Somebody's trainee doesn't have food to eat, somebody's ex-trainee doesn't have food to eat, somebody's getting calls saying we're stuck, what do we do? And so we had to re-look at what we are doing. So we said, okay, we are 2,000 people, may not be big enough to deal with 200 million, but big enough to start doing stuff. So we started something called an essential supplies, for whatever word you call vertical, and said, let's just figure out how to give basic staple and food to whoever requires our support out there and take it off. And I think in that sense, we worked a lot to get, there were passes, there are government rules on in a lockdown period, who can go out, who cannot go out, how do you do? So it's been a whole learning experience for all of us, right? We're not used to understanding what's the price of an onion and what's the price of oil. I think that's the lesson at one level that we've learned. The other is we had those who were in classroom. We said, let's just move virtual. And that's also been a major transformation for us as a company, to understand how do you teach in a virtual classroom vocational education and be relevant? How do you ensure that, and we found this is the time to talk of career paths and new career paths. So I think we've got to ask them to say work is important. Reimagine your communities. Economic unit is not going to be migration anymore. You're going to have boundaries. So within your boundaries, what are economic activities one can do? I do believe that income is not about earning, but it is also about mind being busy, body being busy, and getting a livelihood. I think that's the goal that we're working towards.
So Gayathri, you had 2,000 employees on site, but they were training about 100,000 people. And you've essentially had to create supply chains for food and shelter for everyone, yes?
We're in the process of creating. I mean, it's like, every day we get SOS calls. So it's like which place, which city, which town, what is the issues? Yes.
And you, like Sara, you didn't stop to say, do we have enough? Where are we going to get the investment capital? You just used the money that you had in your company and started moving, dealing with the situation, which is beyond astonishing that you did it at that scale, and that you are essentially running tent cities and warehouse cities and building supply chains that didn't exist. Meanwhile, the idea of doing distance learning with the construction workers and the beauty workers and helping them try to imagine. When I visited you on one of the visits that we did, I remember being on a construction site and talking to young men who were 4,000 kilometers away from their homes. And just even thinking about them getting back, thinking about how rural they live. How do you start to reimagine work when the construction industry most likely isn't going to do a lot other than hospitals in the next few months at least?
So I feel one of the things that will happen is the entire construction will change. As I said, let's look at another statistics. India has 600,000 villages. So 600,000 villages, in 600,000 villages, we have 55% of those villages are less than 2,500 population. So economic activity has to be defined in the village. If they're not going to migrate, that means supply chains have to be built there. Fabricated hospitals will probably be there. And I've been thinking, we have these steel companies which are there. There are fabricators. So, we have a trade called bar benders and shuttering carpenters. I think retool them to be fabricators and get them to start having, buildings there and get that okayed by government. I've also been, sort of Googling it.
For people who don't know what a fabricator is, just the construction guy in the village, what's he fabricating?
So a fabricator is somebody who you need like welding tools, puts together the structure, the steel structures that are there, puts together. And to fabricator doesn't need steel anymore. There are material available which can be quickly assembled together. So think of it like a very bad analogy, but think of it like a do-it-yourself kitchen. You can quickly fabricate, a fabricator, as the name goes, can quickly put up a structure. So the structure, if you can put up sheds like that, these can be used as isolation wards for testing. And I'm thinking that there's going to be a huge demand for medical related infrastructure. So that's one that we're thinking construction workers possibly can do, because as you said, that industry is not going to revive in the next 1 year. So it's going to be things like that we have to redo with them.
What's fascinating, and this is what links back to Sara, is that you are essentially starting to make the case that even large-scale construction needs to be decentralized into more of a gig economy where people are building locally and hopefully using more sustainable materials than steel and concrete. Is that how you see it?
Absolutely. Absolutely. I'm saying in every field, Jacqueline, we'll have to look at it. So I was just having a conversation with a young social entrepreneur, because masks are going to be compulsory in India. So that's going to be a new fashion statement, right? So I was looking to see, can you have filters and khadi masks which can be produced by tailors? We now have to really reimagine our livelihoods. We've got to rethink how we're going to do it. It's no more about cloth is okay, but cloth masks are not. You need filters. So can we use khadi, and therefore can material come in a manner in which it's sustainable, but at the same time it's so I think for every single vertical, auto vertical, you're not going to have bikes and cars selling. So what's the alternative? The alternative to me is you have to sanitize every medical vehicle as well as municipality vehicle. Teach every auto service technician to sanitize. So we'll have to look at intelligent solutions for sectors and people who are employed. And I come back to it. We have to rethink our economic unit. We've always thought city is our economic unit. Big companies are our economic unit. Now this has forced us, the affluent, the middle class, the educated, to say you are sitting in your rooms, you are doing video conferencing, you're doing work from home, but the poor have to work. So you have to reimagine their work to be relevant to yours, and probably communities will get built better.
That is extraordinary in the way that you just said it. Final question for you, Gayathri, because again, like Sara, we're starting to see themes. LaborNet was really built in partnership with the corporate sector, corporations that would work with you to not just train people, but to actually help them learn critical skills and critical thinking. And that is something you've been spectacular at. Government increasingly turned to you around policy for vocational training and reimagining that as well. And how do you see these new partnerships with government going forward? Is that even a conversation that is beginning in India?
At this point of time, we are having a conversation with our, what we call a Ministry of Decentralized Governance. One of the things that I've been observing is when we decentralize, when the decentralized government, these are basically village units, revenue units of the village that the government is supposed to give money to. The bottommost unit which is there. Unfortunately, we've given money in a manner in which you give 5,000 rupees for education, 10,000 rupees for something else, 2 lakhs for something else. I don't know the amounts, but it's a piecemeal, each department. I think we should think like, I was thinking we should think like acumen. We should think like accelerators as VCs. Why don't we create a fund pool, give it to that community and say, you know what, you rethink your village. You rethink your economic activity. If I'm sure they know what health means, they know what income means, what education they want to spend with. So imagine instead of getting 5,000, 2,000 and 3,000 rupees or whatever 100,000 rupees for X things. Suppose I was able to give them, maybe 1,000,000 rupees and say, now you rethink your village and use it in whatever manner you want. I think people will think better. We assume we know what everybody wants, but I think the COVID virus has been an enormous equalizer. It's taught us, listen, you don't know. You say communities have to come together. Let's do it. So cities have to be rethought, right? We have shanty towns and slums. I mean, I'm not even able to imagine how people are living in social distancing in a slum. How is it possible?
They're not.
It beats me. But we are dependent on that economy surviving. The big corporations are dependent. We are dependent. So we better have them have the money to buy. In that case, we have to rethink our lives. So I think the big learning for me is rethink our lives, rethink our businesses, rethink our strategies. I think we probably come back stronger.
I love it. Rethink our lives, rethink our businesses, rethink our strategies. It's an incredible way to end, Gayathri. The scale at which you are working and just the breadth of your moral imagination, just moving so quickly simultaneously into the future, and the sense of really hard-edged hope that you and Sara both have is just astonishing and wonderful. So thank you for both of you. I see Mona Sinha, who's really been working with a group of some of the more effective women philanthropists in the world. And Mona, I'm wondering if you could say a little bit about how philanthropists are thinking about this time, social entrepreneurship. Are there opportunities that we should all be looking at pivoting into?
Absolutely. I think what we have done as the group I lead is a group called Women Moving Millions. It's a group of women that support women entrepreneurs and invest in businesses philanthropically and otherwise. And I think some of our members are actually on this call, which is exciting to see. So we've doubled down in our commitment to continue supporting the groups we support and helping them in any way necessary. What we're also doing is sort of shining a spotlight on issue areas that many of our members are interested in. So for example, today we have a session on domestic violence and how women who suffer are really being affected by being isolated and what options are there for them. We have another session coming up on mental health. Hopefully Jacqueline will speak at one of our sessions about what Acumen is doing. So we're using these opportunities to sort of as a teaching opportunity for our members to double down. On a personal level, I'm using my knowledge in raising funds and thinking about how to pivot. I was a restructuring corporate person, and so in some ways I can apply some of those lessons to what many of you are facing in your lives and careers. So I've had numerous calls with people who reached out, who just want to connect, and a lot of it is allaying fears because in times of uncertainty, people don't know how to respond. They kind of know what they want to do in their heart, but sometimes it just freezes up, and sometimes it just needs, a sympathetic voice or someone who says, I'm with you, I'm behind you, I'm supporting you, to help people unleash that potential. So there are lots of, and there's a group of us that are working frenetically. We're in New York, so the situation is pretty dire in terms of frontline workers. So we're doing sort of small innovations, supporting restaurants that are providing meals to ER doctors, for example. So lots of our local community restaurants have set up funds that we connect with. There's a group that's raising money to
Mona, thank you so much for that. And I just want to make sure, because we only have about 4 or 5 minutes left, that we get others, as well as if people have questions coming in on the chat for Gayathri and Sara. But Sekar Puli is, I've been talking to a number of university presidents who are fearing, actually, that maybe the whole game of university revenue streams and the way they're set up are being changed as we live. And so I'd be interested, given that many of the US university presidents are quite worried, what are you guys thinking about in terms of retooling education? So Sekhar, you want to say what you're looking at?
Yeah, so I think, I mean, the challenge that we have, like you said, on the US front is more about the revenue streams. But the problem this is addressing is hitting across the globe and without any barriers, right? And I do feel that the innovation for this one is going to come from the bottom of the pyramid in this case, and especially from the fields like what Gayathri and Sara have been working in the emerging countries. And I'll be very interested to see how we can help come up with low cost, because this has to something scale at a global level, and we need to come up from where the need is and where there's a need for lack of funds. I think that's where the innovation is going to come from, and we need to see how we can help those low cost areas where we can fund them to innovate and look at it from a global scale.
I love that. And it keeps coming back to me, and how do we think about Acton's community as a real voice for that. Mahesh, just if you could keep it very short, but what you're thinking about with Acumen Academy and listening to everyone, how do we need to think about retooling?
Yeah, I think there are two parts to it. One is looking at the assets and seeing that how they are going to be relevant for the future, and the digital tools and other things which we are building on the academy to bring the community together, like what we're doing, and making that action-oriented is one thing we'll have to think about a lot. That's one. The other one, it really struck me when Gayathri so eloquently, far better than me, talked about how we all have to reimagine the economic unit. If the economic unit changes, I really think we also have a role to think what's our investment model and how can we relook at the way we think about investment to build resilient companies which can work in the communities. I think it's on us to think about that than going through the same old.
What is investment? What are the new business models? What is the new, not just economic unit, but social unit? What are the anti-fragility strategies? All of that is coming up from all of you. Before we end, I want to just give Gayathri and Sara last words, because you two have just been unbelievably eloquent and powerful, and you're working around the clock, and you've still given your time to us. So Gayathri, this time I'm going to start with you. If you could keep it short, and then I'm going to turn to Sara.
I think, economics has always been defined by economists. And they've defined it as GDP, and that has defined our entire way in which our public funding has happened. Now, actually, the entire social distancing will bring in different the social fabric of our lives will change. So I think from that we need to build economic units, and I think. Maybe it's a bit idealistic, but Gandhi had defined economic units. So Gandhiji had defined that. Of course, that was close to 80 years back. But having said that, I think it's time for us not to be lazy. I think it's time for us to put our thinking hats on and think differently. What do we want out of, what do we want? I'm at an interesting point in my life. I think I'm close to 50. So I'm thinking the next 30 years, given I have a long-lived life, needs to be very different. So I think it's for all of us. Now I find economists are saying universal basic income is important, which they didn't all this time. Like Mahesh said, private equity investments, probably the lesson it gives to us is innovate low-income models of learning, of working, of sale, everything. So I think we need to reimagine those elements, and I'm looking forward to getting out of crisis mode and actually working towards a future. Crisis is crisis. You're only handling, as I told you, all I'm doing at this point of the time is know the price of onion and potato and cereal. But I think people need to start living life. So when they live life, they need to live life fully. So how are we going to assist people to think of their life? our job is of a teacher to say, you've got to live your life. I think that's really where I want to really end.
Thanks.
Thank you for the opportunity, Jacqueline.
Thank you so much. And for everyone in our community, my husband Chris is going to interview Gayathri on TED Connect, which I think Maureen is putting in the chat tomorrow at noon New York City time, really to talk about the issue of what's been happening in India and her approach. She's also looking to raise $1 million in grant money for essentially to shelter these 100,000 people. And so if you know anybody, Acumen is also raising money for an emergency fund, which I can talk about if we have time as well. But Sara, I want to give you a chance, and also just your last words.
I'm just going to say what I'm feeling right now. I think this pandemic has taught us that countries don't matter, wars don't matter, our individual interests don't matter, survival matters at the end of the day. And if it's one lesson that we can learn, the lesson that I've learned is there's so many things in my life that I don't need to do, that I don't need to be. And so much of that can be given to other people, that can be spent on more important things. So I think I think where I want to go for a future is reimagining it with things more important, more crucial to survival, more crucial to equality. Because all what this is teaching us is that no one is immune, no matter how rich, how powerful you are. No one is immune from the virus. A thing that you cannot see can destroy you. So that's one lesson that I'm learning, and I just want to say that out, that I hope that remains with the world, even when this is over.
Well, thank you, Sara. Thank you, Gayathri. The two of you so embody the values that we hold as a community, and you do it so powerfully and so beautifully, and you make us so proud. And certainly I feel deeply motivated to take that reimagining to every aspect of my own life. And I have a feeling that all of the people on this call are thinking about where that has application for them too. I would just say for all of you as individuals, and critically, as Mahesh says, for us as a collective, for us as a community. How will we redefine capitalism, investing, the economic unit, the materials that we use? What is health? What is dignity? These are questions we've been grappling with. These are questions that we hope to get more people in the world way beyond us to be using and thinking about through Acumen Academy. And I couldn't thank you all more for this. My team keeps telling me to ask everyone to follow me on Instagram because we're getting ready for this book launch on May 5th. And so we're going to need lots of ambassadors for the moral revolution. We will be fully launching Acumen Academy on May 5th as well. And you all know how to get in touch with Gayathri and Sara for questions, for support. But every Pakistani, every Indian, everyone in the Acumen community should feel so deeply proud of these two human beings and what they are showing the world it's possible to do with the right character, the right kind of capital, and certainly the right kind of community. Much love and Godspeed in this next week to everyone.